turning on the Zoom to YouTube live link so that we'll have this available right after our event for sharing purposes. And here's David Kravitz coming in. And we have one person on the phone from 709 area code. Thank you for joining us, but I can't see who you are, but thank you for listening in. Just as a reminder to everyone who's joining us that this is being recorded and that we will be sharing this meeting with the Minister of Seniors with our members following the event. And there is also media has been invited to listen in as well. And they'll be able to ask the minister questions, hopefully related to our conversation today, but you never know, following our meeting, just at the tail end of our meeting, the scheduled for 1 hour. Is Bill Van Gorder on the line with us yet? Not yet, so we'll wait a minute for Bill and then we'll get started. There's Bill coming in now.
I'm hearing some lovely music in the background.
Well, I'll ask again if everyone could mute themselves until we call your name. We're going to start off with introductions and some words from the minister, and then we'll open up the floor for our conversation. Bill, are you there with us yet?
I am.
Hey, all right. Terrific. So I'll start to say thank you and welcome to everyone. We were delighted to hear that we were able to find a window of opportunity to speak with the Minister of Seniors in her very busy schedule following a budget. So I will be the technical moderator, and Bill Van Gorder, our Chief Policy Officer and Chief Operating Officer at C.A.R.P, will be our host. And then we will hear from the minister, and I will then open the floor up to questions. I have a number of questions lined up from across the country. We'll start with those, and we will continue the conversation until we get to our hard stop just in less than an hour. So over to you, Bill, and thank you very much.
Okay, well, thank you very much, Anthony, and welcome everyone. It certainly is a pleasure to see so many faces on the screen today. So many of you here, and also Minister. So pleased to see you here. I found you on my screen. I was sorting through there so I could see you face to face. We really appreciate you taking the time to be with us today and speaking with our leaders from across the country representing our 325,000 members. I'm going to have very little to say today because thanks to your generosity, Minister, you and I get a chance to speak often. So this is an opportunity for you to speak directly with our leadership from right across the country. So thank you to you and your staff and to Anthony for setting this up. And I invite you now to make your opening statement, and then I'll turn it over to Anthony to manage the questions. So welcome again, Minister Schulte.
Thank you very much, Bill, and thank you, Anthony, for setting this up. I really appreciate the opportunity to meet with all of your leaders, all volunteers working very hard on behalf of seniors. And as you said, I had a great opportunity to connect with you on budget day, but the budget is a really good budget for seniors. And it's a nice chance to have this discussion with your, like I said, your leaders from across the country that have been listening to seniors and have that opportunity to have a bit of a dialogue. So I definitely want to thank everyone for giving me this opportunity to connect. C.A.R.P has tremendous reach, as you know, and I always value your input as we work to improve the lives of seniors. Your report with recommendations was large and was extremely helpful. So thank you very much for all the work that you do, continually striving to, as soon as we get one thing solved, let's solve another one. There's lots to work on. So this is really the first time that I've had an opportunity to hear from all of your volunteers all at the same time. And I'm definitely very interested in hearing from each of you, as many as we can today. As you know, the Government of Canada is committed to strengthening the financial security of seniors and improving their quality of life. La sécurité financière des aînés est notre priorité. Some of our first actions for seniors 65 and up included restoring the age of eligibility for old age security from 67 back to 65, increasing the guaranteed income supplement for nearly 900,000 low-income seniors, providing almost $1,000 more to help them, and doubling the Canada Pension Plan for future retirees. Budget 2021 delivered more good news for seniors. And as we know, seniors deserve more financial security later in life because that's when they're worried about outliving their savings. As they age, their costs rise, their healthcare costs rise, all the while they are more unlikely to be able to work, face having disabilities, or be widowed. To improve seniors' financial security and peace of mind later in life, we'll increase the support for seniors aged 75 and older. This is our campaign promise, and we're delivering on our promise. To provide short-term support, we'll provide a one-time payment of $500 in August of this year to old age security pensioners who will be 75 and over as of June 30th, 2022. Then in July of 2022, we'll be permanently increasing the regular old age security payments by 10% for seniors age 75 and up. This will provide around $766 to full pensioners in the first year and then be indexed to inflation going forward. The OAS increase will strengthen the financial security of 3.3 million seniors and lifts over 60,000 out of poverty, 65% of whom are women. And it's the first permanent increase to the old age security pension since 1973, except for adjustments for inflation. So this builds on our direct financial support that we provided during the pandemic. As you know, we provided an extra GST credit and a one-time payment to seniors eligible for OAS and extra support for those that were on guaranteed income supplement. Altogether, a low-income couple received over $1,500 in tax-free help with extra costs during the pandemic. Everybody's mind's on the vaccine program, and it is rapidly accelerating. Canada has distributed over 14 million doses to the provinces and territories, and we've moved up delivery dates for millions of doses. We are now on track to receive 48 to 50 million doses by the end of June, and you're hearing that we have Pfizer coming in at 2 million a week, and it'll be going up to 2.4 million a week in May. However, we all need to still be careful about our actions and our choices and consider how they may affect others in our community. We must continue to protect ourselves and our loved ones and the most vulnerable. Our government will always be there to partner with provinces and territories to keep people safe. Working together is what will get us through this crisis. More than 8 out of every $10 spent to fight COVID-19 and support Canadians continues to come from the federal government. We procured billions of personal protective equipment and we are still continuing to procure and provide rapid tests, millions of rapid tests to help fight this virus. And we funded over 5,000 New Horizons for Seniors programs across the country that support seniors directly in their own communities. Many of these projects help seniors connect online for the very first time by providing tablets and help how to use them and get the group activities like exercise classes, access to mental health supports, access to family members. And I've heard very inspiring stories of seniors that for the first time have gone online and be able to connect with family members around the world. And they say it's changed their life. So if there's any silver lining, which it's hard to find in the pandemic, it's that we've been able to connect so many seniors now online and get them connected to the internet. To better protect seniors in long-term care, we will provide $3 billion to provinces and territories to ensure standards for long-term care are applied and that permanent changes are made, because everybody's seen the tragedies in long-term care, and all levels of government have to work together to help. Even though it is a provincial jurisdiction, we're there to help and support. We've invested billions in infection prevention and wages of long-term care workers and others. We're also going to establish new offenses and penalties in the criminal code related to elder abuse and neglect. Across the country, most seniors want to live in their own homes for as long as possible. To help seniors stay well in their homes and live longer in their homes as they age, we're launching a new program called Age Well at Home. This initiative will offer practical support to help low-income and otherwise vulnerable seniors age in their homes. Senior serving organizations will connect seniors with help for tasks that they are no longer able to manage or do, like meal preparations, home maintenance, daily errands, yard work, and transportation. Budget 2021 also announced additional funds to build, repair, and support affordable housing units for vulnerable Canadians, including seniors. Improvements to the criteria of the disability tax credit and other related support to help more people access these programs is something that we heard and responded with. An additional 4 weeks of the Canada Recovery Benefit is now available, will be available when the budget is approved, and that will be very helpful to those looking after those suffering with COVID and need the time off from work to be able to help. And new funding for veterans and palliative care. There's a lot in this budget that I'm looking forward to having a good discussion with you about, and I look forward to answering your questions. Thank you very much, Bill.
Bill, just over to you for a response, and then we'll open the floor to start the conversation.
All right. Well, I don't want to take a lot of the time from our volunteers to ask their questions. Just thank you very much for the statement, Minister. And certainly we will be following up with you on all these issues and offer whatever advice and assistance we can from our members across the country. So, but let's turn it over to the questions.
All right, then. Thank you, Bill. And thank you, Minister, for that opening statement and remarks on the budget and what the government is doing for older adults across the country. I wanted to first invite our president of the C.A.R.P White Rock, Surrey, British Columbia chapter to unmute, as well as Terry Miller, the president of the Brampton, Ontario C.A.R.P chapter. And they both wanted to discuss with the minister the issue of vaccines and accessibility. So Ramona and Terry, welcome, and I'll ask you to start the conversation.
I guess
Hello.
Ramona first.
Oh, who's going first? Shall
Go
I
ahead,
go
Ramona.
first, Terry?
Yes, please.
Okay, ladies first.
ahead,
Thank you very much, Minister, for being with us today, and hello from beautiful British Columbia. I would first like to acknowledge that we are growing the spirit of community on the ancestral and unceded territories of the Semiahmoo, Kwantlen, Katzie, and Tsawwassen peoples. My question is, some seniors, as well as others, are worried that they will not get the second dose of the COVID vaccine for quite some time. Some are worried that the first dose is not enough to protect them. What should I say to my members who call me and express concerns that Canada is not moving fast enough? Some are frightened, and it worries me.
Do you want me to answer that first, or if Terry's got?
Well, Terry,
time?
thank you, Minister. Go ahead, Terry.
I'll have a subsequent question to that. But go ahead and answer that one.
Okay, fair enough. So absolutely, everybody's concerned. They want to get vaccinated as fast as possible, and we are working really hard to do that. As I mentioned in my introductory remarks, we're ramping up. Obviously, we're ramping up as fast as possible, but we're now at 2 million a week from Pfizer, and be ramping up to 2.4 in May. So we're well ahead of what we anticipated that we were going to get because of the hard work of our government and the minister Anita Anand. She is doing this 24/7 pretty much. I don't know how she sleeps, to find every availability, as all of the world is scrambling to try and get their hands on as much vaccine as possible. So what happened, NACI, which is the National Advisory Council on Immunization, they are experts in immunology and virology, and they have been providing an advice to governments and Canadians. They're not a group that just started during the pandemic. This is something they've been doing for a long time, for many decades, but they've come forward and said, based on the number of vaccines that we have available and coming in, and as I said, we're ramping it up, they have said that the best way to save lives and to get Canada in the best place possible as fast as possible is to get at least one dose into as many arms as possible. And then as we get more vaccines and we get through that first vaccination attempt, to then do the second dose. That looked like it was going to be 4 months. And they said, based on their information that they have, they felt that that was not going to be a problem because people's immunity was able to stay up. But we always know that even when you have vaccination, and even a double dose, which will be better vaccination, you're still at risk. So we still have to follow the public health measures until we can knock this virus down to very low numbers and not have the kind of community spread that we have going on right now. We also recognize that there are variants that are being generated by the raging virus in parts of the world, and those variants may affect our vaccination program. So it's really, really important that we get vaccinated as fast as possible. I think I've heard the number, about 75% need to be vaccinated to get that herd immunity that we need to be able to make sure that we're protecting even those that cannot get vaccinations because of their own health challenges. So it's not the government saying that there's going to be a delay. It's NACI, this panel of experts that are saying that it's best for Canada to put more people vaccinated than just have a smaller number, fully vaccinated. So it's better to have, and even one dose protects you from serious illness and death. So this is where the recommendation is coming from. But that the provinces and territories are the ones that are making the ultimate decisions on how the vaccine's rolling out in their provinces and territories. And some of that also coming back from their own public health guidelines. So you've seen the shift. First, it was definitely, let's get the oldest people vaccinated first because they're the most vulnerable. And then let's start going to the areas, start going down in age. And now let's go to the priority areas that are in outbreak so that we can try and get it under control in those communities and those settings that are so challenging and are creating an opportunity for this virus to really spin out of control. So that it's not the government deciding. It's actually, our job is to get the vaccines in as fast as we can. It's the provinces and territories to get them in the arms as fast as they can. And we are seeing that really start to ramp up now. I expect that 4 months delay is going to shorten significantly as vaccines are really ramping up now.
Deb, it's interesting you make those comments. There are a couple of things that you probably know, and that is that the death rate in Ontario is skewed towards people over 60. If you look at the Toronto Star last week, they had a graph that showed that while the infections were in lower ages, the deaths were definitely in the higher ages. Mm-hmm. When you talk about herd immunity, it's really difficult for seniors to understand that when in fact only one dose is given and then 16 weeks later you may get a second dose. That 16 weeks is the only place in the world where 16 weeks is the figure, maybe India now, but certainly that we know of, is Canada. So whatever NACI says, that's one thing. But the fact of the matter is that we don't want to see people die. Mm-hmm. And the death rate is not the other way around. It's not amongst the young people, it's among older people. So some action has to be taken, and I'm pleased to hear you say that you think that the length of time will be shortened. But the fact of the matter is, it's got to be shortened. And you're the Minister of Seniors. You can certainly go to NACI and say, look, give us a timeline. That's all seniors really want to know is when. And then they can manage it. 16 weeks is far too long. Even the manufacturers say 21 days. Mm-hmm. And at very most 10 weeks. But now we're getting into the 16 weeks. And that's really not fair to seniors. So that's all I have to say. And I hope that you guys really understand that this is a real problem for seniors.
Absolutely. We recognize the challenge for all Canadians, actually, but it is seniors that were most affected. And the biggest risk factor for death and serious illness is age, which is why NACI recommended that you start with the older seniors and that you work on those seniors that are in congregate settings where they're at most risk. We saw that in long-term care and some seniors' residences. Get the double doses. So you'll see that there's the significant push was from the provinces and territories based on the science and the recommendations to go into those congregate livings and get those second doses done. And I have a father-in-law in long-term care and not long-term care, in seniors residence, and they were done very early on, second doses. So that's been a push in, different provinces are doing things differently, but you saw it in Quebec, you saw it in Ontario to focus on those seniors that are most at risk and those seniors that are in congregate settings where they are most at risk to get the second dose. So I hear you, Terry. We are working to get those vaccines in as fast as possible. We don't dictate to NACI anything, okay? The government does not tell the scientists, the experts in this research what they need to say or what they need to do. They give their recommendations, and their recommendation is that on average, a person's immunity is able to be strong for a longer period of time than what the manufacturers have said. I'm not going to start refuting it. That's not my world. I used to be a bit of a science person, but I'm in the world of politics right now, and we don't want politics to be making a decision about who's going to get them. We want the scientists. But the most important thing is we can accelerate this if we can get more vaccine. That's our job. Get the vaccines in Canada as fast as possible and get them to the provinces and territories, and they need to get them in the arms as fast as possible. That's what we're doing right now. You're seeing it ramping up. I hear you, Terry. We are very mindful that everybody wants to get it soon, but even if you get it, you need to make sure that you're still following public health guidelines, because until we're in a better place overall and we have minimal community spread, it's still a risk. So we need to still protect each other. Okay.
Thank you, Minister. I want to introduce you now to Rick Baker. He's the chair of our Ottawa C.A.R.P chapter. You may already have spoken to Rick in the past, but here's his question.
Hello, Minister Schulte. Good to see you again. The importance of a national senior strategy is even more relevant now, as we have all been affected by the COVID-19 pandemic and subsequently the vaccine rollout. At C.A.R.P even, we've had over 16,000 show some form of interest in our archives. What is the status of the strategy? As I understand, there have been a number of iterations with lots of thoughts and recommendations. Where does it sit?
So Rick, thank you very much for that. And you're absolutely right. I mean, even the Parliament made a recommendation that we look at a national senior strategy, and we asked the Seniors Council to come forward with some recommendations on how we could have at the federal level a strong role in being in a framework of a national senior strategy. So that work has come forward. We are analyzing that work. We'll be coming forward with how we're going to incorporate what the recommendations are. But as you know, Rick, we have had a pandemic, and our focus right now has been on getting Canadians through the pandemic, getting the supports that we need for seniors in long-term care and in the community. And we put extra money in last year to increase the New Horizons for seniors so we can get seniors the supports that they needed right in their community, including rural and remote areas. So we've been very focused on getting everybody through the pandemic, getting the vaccines that we need, getting the supports to the provinces and territories, And you can be sure that, once we get through this pandemic, we'll start to take a much closer look and be able to have a proper conversation with you on what we think at the federal level would be important, because we're seeing senior strategies in the provinces and territories. They're doing their own. Now we have to kind of see how a federal framework over the top would be of assistance. And that's what we need to work on.
So as a subsequent question to this, then there's a lot of discussion regarding national standards of long-term care homes and the urgent need to include emotion-based care in the standards. Can you assure us that in your particular role of trying to encourage better standards in the province, that this will be certainly integrated? I believe also, and I've spoken with some of your staff, you may have heard that in Ontario with the Carp Ottawas especially, we're hosting a huge long-term care town hall this coming Thursday, and we have probably about 600 people on the call already. But what's more important is we have some of the best experts in Canada talking about the long-term care, and you know a lot of them from your days in your portfolio. So again, it's just to get some assurance from you that long-term care will certainly, with the standards especially, be integrated into this.
Well, you can be clear that we have a focus on this. You wouldn't get $3 billion to be, earmarked in the budget specifically to help provinces and territories to adopt, enact standards. That wouldn't be there if we didn't have a strong will and intent to assist the provinces and territories in this. It's their jurisdiction. Yep. So, we have to be working with them, and we've already started that work. And that the Canadian Standards Association and Health Standards Organization are working to develop standards, and that will be informing our work as we move forward with the provinces and territories.
Yeah, it was a really strong recommendation with the latest commission that was just done here in Ontario. So I'm sure you're quite familiar with that.
Well, absolutely. That was a very damning report that came out. I've also had a look at the BC Advocates report that she did. Her report kind of was before the pandemic, but I've had lots of conversations, a few conversations with her. I'm watching the work that other advocates are doing across the country as well, because there's a lot of information now coming forward, but it really centers around a couple of key areas. The facilities themselves and the improvements we need to do the facilities. And we already stepped up money in the budget in the fall economic statement to help with our infrastructure, with air conditioning, with air filtration, and with sprinkler systems to improve the safety of seniors. So we've been stepping up to develop a program to get 4,000 more PSW workers trained up and then allocated into the spaces that are required across the country. And then, of course, we'll be working with the provinces and territories to adopt standards. So these are things that we've already, like some of the work we've already been doing and some of the work that we're going to be doing, but we recognize it's a damning report. All three levels of government, even municipalities that in some of them are running some of these centers need to step up and do better.
Well, thanks for your time, and certainly we'll be in touch.
Thank you.
Thank you, Rick, and thank you, Minister. I'm going to ask Bev from the Greater Bay of Quinte chapter to unmute her mic. CARP has been advocating that one of the best antidotes to concerns about long-term care is the improvement of home care. I think Bev's going to talk about that.
I'm delighted to be able to speak with you, Minister Schulte. I have a passion for community services to be available for people in our age group. I'm 75 now. I worked for 50 years in health services as an RN and a nurse practitioner. Excuse me. I haven't heard from any of our chapter members that they're just waiting to get into long-term care. I think possibly a great response is because of what's happened more recently, but even before that, people were not longing for those kinds of settings. I worked in home care for 27 years as well. I know the federal government did provide some funding towards those services at one point. I believe the Ontario government didn't use that funding appropriately or the way it was meant to be used. And I want to know that the federal government is going to make some changes and stipulations around funds that are provided. This group of people that I'm involved with through CARP come from many different backgrounds. We're very interested in what's going on in our country, in our province. And CARP is giving us new skills in terms of advocacy, how to advocate in our own communities and in our province and in situations like this as well. Our politicians will hear from us. Our age group is of the demographic that is the largest cohort of voting population. So the politicians will certainly hear from us when we're pleased with their efforts, and we want them to hear from us now when we're not pleased. We certainly don't want to go to long-term care. We want a full range of both professional and supportive programs to allow us to remain in our own homes. We're not cattle, and we don't want to be housed in huge barns. Bricks and mortar don't determine high quality care. High paid CEOs with a business background don't determine good quality care. Well-educated, good quality frontline health care, home care staff do. The message is we don't want to go to long-term care. We want well-educated, well-paid, respected frontline home care, healthcare staff. And politicians generally have caused immeasurable damage to the healthcare system. Health experts have told them how to fix it. And the message now is just fix it.
Thanks, Bev.
Thank you.
So Bev, thank you very much. I hope people don't mind. I'm writing down because I'm 61. I don't know about you guys, but if I don't write things down, I kind of forget a few key points. So I'm writing it down. And so I just wanted to say, I hope that you're happy with the announcement that once a senior gets to 75, there's going to be a little bit of additional support coming in. $766 a year will be coming to those at 75 and over that are on a full OAS pension, and you'll be getting $500 this August. So that's good news for seniors 75 and above. But I wanted to go back to, you did mention that, there's things that we've done during the pandemic. We've put billions more dollars on the table to provinces and territories to help with the healthcare system to get through the pandemic. But let's look back at earlier steps that we took as the government was looking at how to better help seniors. It was, seniors need more home care. They didn't want to go into long-term care. So we put our money in a $6 billion increase that was earmarked specifically for home care and palliative care in the communities across Canada. So it was money that was going to the provinces and territories, and we had individual bilateral agreements with each province on how that money was going to be utilized. But it is challenging because they would prefer that we don't tell them how to use money, that just give the money, and they're in charge of health delivery in their own province and territory. But we are trying to make sure that the outcomes of the money that we're bringing forward is significant and can be seen by the communities. And home care, we know, is very, very important. It's also why we put in this existing budget, well, actually, it was in the fall economic statement, that we're wanting to put more PSWs, be able to get them certified, they're not certified, but be able to get them trained and then into work placements and supported so that we can have more people working in the sector to be able to help seniors in long-term care, but also in home care, and it's the quality of those people and the education, the experience they have that is going to make the difference in the care that people are receiving in their communities. But we know, as you said, they want to stay in their homes. So what else are we doing? And that's why I mentioned that age well at home, because it's different. Home care doesn't necessarily provide them with, yard work or maintenance. It's not there for that. It's there for their health care. And so there's another aspect that we've heard.
Yeah.
Exactly, that we've heard seniors say, I can't get the support that I need through the healthcare system. That home care is there for my health, but I need other kind of supports. And that's why we stepped up to do the Age Well at Home. But don't forget the National Housing Strategy, because you mentioned about seniors not wanting to be warehoused in these large buildings. The National Housing Strategy had a co-investment component, which allowed any creative idea to come from the community. There would be a sharing of support through the organization, through, you know, maybe they were getting their portion through provincial or through another mechanism, but it allowed us to partner with communities to create the kind of residences that they're looking for. So you didn't say you had to be 100 size, whatever. It was what is appropriate for your community. Can we get the cooperation of, you know, your, it would be, you know, an organization, a charity, a not-for-profit that is running these things. Can we work on something that provides that diversity? Seniors don't want to live in these big, large, they want to be in a sort of a community, a smaller housing unit where they can have some privacy in their own unit, but then also have the community supporting them when they need more care. And there's so many very creative ideas on you look at Europe, you're looking even in the States and here, people are coming up with very creative ideas on how seniors would like to age, and it's not institutionalizing them. So we're there with the National Housing Strategy to be partner with communities to do just that. I could go on. There's quite a few things because it's very diverse. All the pieces of the puzzle that need to come together to help support seniors to age in their communities. But we're there in all these different aspects to try to be a partner so that we can get better outcomes for seniors as they age.
Thank you, Bev, and thank you, Minister. I wanted to go a little bit faster if we can with time and make sure we get representation from right across the country. So we're going to jump east to Sharon, who's the president of the C.A.R.P chapter in Newfoundland and Labrador.
Hi, good afternoon, Minister. Nice to speak with you again. I would like to push a little tiny bit on the topic that Rick raised, and that has to do with the Health Standards Organization and the Canadian Standards Association that have been identified as working on these standards for the government, and that they will advise you on what should go forward into the future. But I'm more concerned about asking, is it possible or is the federal government willing to take a stronger stand with the provinces to make sure that these standards, when they are developed, can be implemented cross-Canada wide? Because unless there's some amendment to the Canada Health Act or some separate legislation, then we're still going to have a fragmented system of nationwide standards that are not universally applied to all of these types of settings. So my question is about, you know, what strength or force can the federal government bring to bear to make sure that the standards are accepted and implemented?
Sharon, thank you very much. You know, I really appreciate that question. It is where to start. Having money come to the table is a good motivator for sure. But you have to, and I'm sure you know this, across the country, long-term care is different in every single province and territory and how it's rolled out. Some territories, the government runs them. You know, some have standards. And we saw that even ones that had standards didn't necessarily fare any better, right? So standards is an important part. And I remember having conversations, because I have conversations with my colleagues, my counterparts in the provinces and territories on these things. And I remember one of them saying they really want to partner with us, they want to work with us, but what they're really worried about is that it would lower the standards that they already have in their province, because they have a higher standard and they're willing to pay more. And so they don't want standards to come in, and national standards to drag them down, because then it'll be difficult for them to be able to keep their standard level if all of a sudden a lower base level is identified. So there's real concerns across the provinces and territories at all ends of the spectrum on what's going to happen. So we're working right now. Those standards are under development. They're under development with organizations that are expert at doing this work. Health Standards Organization does this for the health system, and they do an excellent job. So they're working on it along with CSA. These are organizations that are national, that are very familiar with doing this and working with the provinces and territories. And they will be informing our work. But in the meantime, we are having those discussions with the provinces and territories, and we have real money on the table to help motivate making improvements.
Thank you, Minister.
Thank you.
Thank you. We'll jump back to Central Canada, and I wanted to ask Jim from the Calgary chapter to unmute and ask a question from Alberta.
Thanks, Anthony, but I thought I was in Western Canada, not Central Canada.
I
But
apologize.
Anyway, that's okay. Want to get rid of Alberta soon, right? Thank you, Minister. I was interested in your mandate letter. I was especially interested in the section where they talked about establishing new offenses and penalties in the criminal code related to elder abuse. We've got documented facts during the COVID about elder abuse and neglect. And I'd like to know how many people have been convicted. And if no one's been convicted, why would we have national standards with no consequences to show people?
Jim, thank you.
I got a ton of other questions, but leave that one.
No, we'll start with that one. And I know I'm being told keep my answer shorter. Sorry about that. I love to have these conversations. So in terms of elder abuse, you're definitely right. We have seen, especially during the pandemic, the reports of what's been going on in long-term care facilities. But we also know that elder abuse is on the rise in our communities. And so we need to look at, and we are, my colleague, David Lametti and I are working with our teams to look at the code to see what we can do to strengthen. One of the challenges is identifying it, right? Making it clear what it is. What's the definition of elder abuse? And it's not consistent nationally. So I'm undertaking a process to see if we can get to a better understanding of the definition. It is very hard to bring someone to justice if you haven't got a real appreciation of what it is you're dealing with. Some of it is hard to quantify. You can have somebody that's being physically, that's pretty straightforward. But when somebody is doing it verbally, or they're doing it through coercion, or they're doing it through just neglect, we need to get a good definition. And then we need to make sure that the criminal code is there to protect seniors. And that's the work we're undertaking now.
So are you saying that the documented evidence, certainly in Ontario, in Quebec, is not clear abuse? And
No, that's
could not,
clear.
pardon?
No, I wasn't implying that at all.
Oh, okay, but
No,
but no one's been convicted, right? There's no consequence, right?
At this point, I don't think anybody has been convicted, but it doesn't necessarily mean that there isn't work going on for the future. So I can't suppose that there won't be. This is now just coming out, and I think there are families that are suing. There's a lot of, there's different work going underway, but we'll be looking at how we can strengthen the criminal code, which is under our jurisdiction, to make sure that we have people held to account if they're going to be seen to abuse seniors. And you're right, it's horrific. We saw that in the reports from our military. from the Canadian Armed Forces when they wrote their reports. What they revealed was abuse and definitely neglect.
Thank you, Jim, for that very important question. It's long been on CARP's advocacy priority list to ensure that those who are perpetrating crimes against seniors are brought to justice. I wanted to ask Renata from our Scarborough, Ontario chapter to ask a question. She's talking finance now. I may have to unmute Renata one moment. No, Renata, I can't unmute you. You have to do that yourself.
Can you hear me?
Yes,
Can
go
you hear
ahead.
me?
Thank you.
Okay. The reason is, unfortunately, my screen broke, and whatever is right at the corner on the left-hand side, whatever little buttons in the menu, I can't see. So hopefully, once the pandemic is over, I can get that fixed. Okay, first of all, I want to say thank you to the Minister for coming in today and listen to our concerns. And what I have right now is just a little bit different, but it's still very important because financial security is obviously very important as you are aging. So one idiosyncrasy I wanted to bring to your attention is the inconsistent treatment of the CPP survivor pension. Usually, when one spouse dies, the remaining spouse is entitled to 60% of the deceased spouse's CPP pension. However, this is not universal. It depends on the amount of CPP the surviving spouse gets herself or himself. If the surviving spouse already receives the maximum CPP amount, he or she will not get any survivor pension. By example, if in family one, the husband dies and his wife did not work full time and thus receives only a small CPP pension, she would be entitled to 60% of her deceased husband's CPP pension. However, if in family two, both spouses work full time and receive the maximum CPP and the husband dies, the wife will not receive any survivor pension, although both deceased husbands contributed the exact same amount of CPP premiums. So the idiosyncrasy is that the payment of the survivor pension is based on the beneficiary and not on the originator of the pension, who actually worked and paid for it. This is certainly unequal treatment and is totally unfair and should be changed. But apart from this unfairness, it can also cause hardship. I mean, I would assume that the current practice of not paying survivor pension, if the beneficiary already receives maximum pension herself or himself, that this is based on the belief that if a person receives the maximum pension already, they had a decent job during their lifetime and should be financially well off.
Excuse me, Renata. We're just getting close to time, so can you just finish the question? Yes.
Yeah, I'm nearly done. However, this is not really always the case. Life is unpredictable, and there can be circumstances when people had very high expenses, such as illness, drugs, not covered by insurance, supporting challenged children, mentally challenged children, looking after parents, relatives, etc. So a person who gets the maximum CPP pension and the maximum OAS pension in 2020 only received $21,240, which is at the poverty level for a single senior, which is set at $21,773, so slightly higher than what that person received. So an extra few thousand would have made that person reach above the poverty level. So I think that should be looked at and discussed, as our CPP luckily is in a good financial position. And I have been told that the federal government cannot make that change themselves. They have to have 2/3 of the provincial government agree to it. So a good time to discuss it, but maybe this year, because I think that the triennial review is taking place this year, because the last one I think was in 2018. So that is something that should be looked at and should maybe be changed to prevent that possibility that people really are financially poor in certain circumstances if one spouse dies.
Okay, Renata, I don't know how many more questions we're going to try and get in, but sorry, this is actually a good discussion and a good topic to discuss, because it's not straightforward. So you know that the CPP is we have to get the agreement of the provinces and territories. We also know that we've just been through a pandemic, and many companies and employees have been struggling. So given the change that we made before, where we increased the financial security of future seniors by almost 50%, that meant that there was an escalating amount of payment that employers and employees needed to do to be able to fund the CPP to provide those enhanced benefits in the future. So what was the pushback on us? Recently, we resisted it, but was to stop that process while we're in the pandemic and while companies and employees are struggling to potentially make payments. Now, we have seen that the economy is not recovering exactly the same in all areas of business. There are some doing very, very well, and there are those in tourism and others that are struggling. But we said, you know what, that enhancement to CPP for future retirees is so important that we're not going to stop that process right now. However, at the triennial review discussion that's done with the finance ministers, they had a look to see, is it a time, because we also made a commitment, and I thought somebody might raise this question, of a survivor benefit and increasing that so that we could help those that end up being widowed and end up having to live on a survivor benefit, which is significantly reduced at 60%. And what they determined is, at this point in time, it was not the right time to be thinking about changing and increasing those contributions at this point in time. So that's not to say that this isn't, this will be back on the table and continue to work at enhancing CPP. But right now, it was determined that it wasn't a good time to be increasing payments. So this is the hard work. Everything that you get out of the CPP is what is determined based on the input that the employee and employers make. So that contract that you went into when you were making those contributions, the way it was designed, the CPP was an adjunct to a worker's pension. And so that's why we've seen the change in workers' realities. In the workplace is very different today than when the CPP was set up. So we have work to do here, but at this point in time, it was determined by the provinces that it was not a good time to be making changes to the contributions that would have been required to make any further changes to CPP. But you can be sure it'll be back on the table.
Okay, I'm glad to hear that. Thank you.
Thank you, Minister, and thank you, Renata. The CPP is always an important issue, and CARP was happy to play a part in advocating for those changes to protect future seniors. But I do note that the majority of people who are affected by the CPP survivor benefit and the decline that comes with the loss of a spouse are women. So if the ministry is looking through that feminist lens, that the effects on women seem to be, and older single women seem to be more detrimental. I wanted to invite the Richmond Delta chapter. I believe David is going to speak, and perhaps the last question for our session. Is Dave Richardson there? I'm going to look for him on my screen.
I am here.
Hi there. Over to you, Dave.
Thank you. I think one of the things that may be helpful to us in the present pandemic is to find ways to involve all the advocacy groups around the country, made up of the volunteers like ourselves who are on the screen here, to be much more involved in the processes of looking at what needs to be done within the revision of and the total reformation of LTCs and residential care. The groups that we are in touch with as volunteers have known for years and years what needs to be done and how to do it. And we seem to be constantly in Canada looking to very highly technical experts in the academic world, in the medical world, and so forth. And the people who have lived this and are not wanting to continue living it are not able to be in what we would call a stakeholders involvement. And we're looking for how that can be done with the numbers of advocacy groups out there. If you're on Twitter and you're on Facebook, on Instagram, on any of the media, you will be chatting daily with colleagues who are asking these same questions that we're hearing today. But our involvement in their solution is not as we would like it to be. And so I want to ask that that kind of connection at the grassroots be considered much more than it has been up to this point. Thank you.
So David, I hear you, and I am very grateful that you're wanting, well, this is what CARP's all about. It's all about advocacy and making sure your voice, the seniors' voice, is heard. And I can assure you that you are, one of the top of my list of who I need to reach out to and listen to as we make decisions on future policies and direction. But I will take your point. The work, there is work undergoing now with HSO and with CSA and Accreditation Canada, and I will work with my team to make sure we get back to Bill to make sure that you guys are included in that stakeholder consultation, because I hear you. You need to be there too. And I'm not running it. Government's not running it. It's run by these organizations who are very experienced. I've had a couple of sessions with them to understand, trying to make sure that that we're going to have an outcome that we're happy with, and that we push them to do it quickly, because it needs to be as fast as possible. But I will make sure that we identify that CARP wants to be at the table in some of those stakeholder sessions, so that your voice can be heard. So thank you, David.
Thank you, David, and thank you, Minister. We've come to the end of our time. It flew by, and I wanted just to welcome Bill Van Gorder back on to wrap up for us, and then hand back over to your staff, Minister, for any follow-up questions coming from the media. Over to you, Bill.
Hey, well, once again, thank you very much, Minister. We really do appreciate you taking this time today, and you know that our CARP members have a number of questions and concerns and messages they want to get to you, and we really appreciate you taking the time and effort to do that today. And I can assure you that we will follow up with you on the request to make sure that our members and our senior volunteers from across the country get their opportunity to have input into policy development as it continues. So I look forward to continually working with you on these files for many months to come.
I very much look forward to it, and I really appreciate everyone coming together today. I'm not the only one that's busy. You're all busy. You have busy lives, and you're volunteering to do this. I'm most grateful, and I really appreciate hearing from all of you, and I will keep